Hello everyone, welcome to Morning Minutes here with Marty McFly. We have Nola here at Polk County Health today, and we just kind of get some information about COVID and the status of where things are right now, and kind of get into some listener questions as well.
Awesome, that sounds great. So right now in Polk County, we're still hanging on to stable cases, and that rate is about 80 cases per day. Now we would like to definitely see that lower, but as of right now, we're about 80 cases a day. And so Iowa is still considered one of the states in the United States that have highest numbers per capita. So we're definitely not declining like we should be.
Gotcha.
So cases are high, and this is what we're going to continue to see unless people are following mitigation strategies appropriately.
Gotcha. Okay, so if people want to find out, if they're having symptoms, when is the right time, I guess, to go ahead and get tested?
Right, so there's a couple different things. So let's say you know someone who has tested positive for COVID-19. And if you're a close contact of them, you want to go get tested. You want to tell your healthcare provider, I'm a close contact of someone who has tested positive. Now let's say you're expressing symptoms of COVID-19. So there's a whole host of different symptoms. Fever, sore throat, headache, body aches, runny nose, cough. A lot of those symptoms might be allergies, might be the seasonal flu. It's a good thing to call your healthcare provider first and talk to them about what you're experiencing so they can rule out things and then see if they need you to get tested for COVID-19.
Gotcha. Okay, so you've called your doctor. They say, yeah, you should get tested.
Yep.
I've seen a lot of these testing centers and pop-up testing centers around town. How can people find out about where those are and the process of going there and getting tested?
So there's a whole host of different places. You can get tested at your healthcare provider. You can get tested at a Test Iowa center. You can get tested at like a Doctors Now. So there's a whole host of different things. So if you just Google COVID-19 testing in Polk County, or if you live in Ankeny, if you live in West Des Moines, they'll pop up and tell you where you can get tested. Some of them will be a rapid test. Some of them will be that you'll know right away. Some of them may take 24 to 48 hours to know.
So if you've had that exposure, someone says, hey, I have COVID, that'd be a time to go get tested then.
Right. And let's say you weren't wearing masks. So if one of the parties was not wearing a mask, then you definitely want to get tested. Absolutely.
Okay. I guess if you are positive, what is the protocol right now for that?
Okay, so if you're positive with symptoms, what we want you to do is follow the 10R1 requirements. So that means you have had your symptoms for at least 10 days. We want you to be in isolation for at least 10 days. Now, isolation means no work, no school, no running errands. You want to isolate from your family members or whoever you live with as much as possible. The one means you are 24 hours with not using fever medication. So you're without a fever for 24 hours, not using any medication. And then the R is most of your symptoms have improved. Now we know that loss of smell, loss of taste, those are ones that might take a while. Now let's say you're positive but you don't have symptoms, asymptomatic. Then you're 10 days from when you got tested.
Okay. All right. So, of course, some people are going to get or have gotten sick, but the best way is obviously prevention.
Absolutely.
So we want to talk a little bit about that. We know wearing masks. We've already talked about that. Washing hands. What else do we have? Social distance.
Social distancing. Absolutely.
What's the best way to implement those, and what have you got for us? Is there anything else we can be doing?
So I think the biggest thing is what we're practicing with mitigation strategies. So wearing a mask. Anywhere you're in public, you're wearing a mask, okay? Social distancing as much as you possibly can. Washing your hands often with soap and water. If you don't have soap and water, use an alcohol-based hand sanitizer. You want it above 60%, okay? Staying home when you're sick, that's a big one. We want you to stay home when you're sick. If you're just getting tested for COVID-19, we want you to stay home until you get your test results. Because think about this, you go out in public, you could potentially expose everyone. And I think the biggest thing too is really important to think about is, think about what you're doing and those actions that you're doing. Because if you live with someone who is elderly or immunocompromised, has an underlying condition, you're putting them at risk as well.
Sure, that's true. I also wanted to bring up, I've seen a lot of people I just got this one out of the washing machine.
Mhm.
You know, it's
Mhm.
nice and clean.
Yes.
But you see some people, there's food, and it's just, you know, so like, what is your mask hygiene?
Your mask
Hygiene, right.
This is what I think your mask hygiene is. How I talk about it is like you wear your underwear.
Sure.
You change it. You wash
Right.
them daily.
And
You're
those-
not going to re-wear your underwear.
Yeah, and the disposable ones, those are ready to go in the trash, right?
Yes. Yep. I mean, disposable ones. If it feels wet, if it feels soiled, you're done. Take it off. Get a new one. Now, if they feel wet and soiled, again, same thing with like underwear. You wash them and you can re-wear them again.
Yeah.
So I always think of mask hygiene as your underwear hygiene.
Sure. That's a good way to look at it.
That's a good analogy.
Wash them.
Yep, wash them. When in doubt, wash them.
Right. So there are like different levels of masks as well. I've heard about the N95, and then like we have these
Yep.
standard ones, I
Yes,
guess.
yep.
When is it time to kick up to the N95? And really, it's about protecting yourself
Right.
at that point, right?
Yep, so I mean, you're both protecting yourself and the people who you're around. So like this, let's say if I was positive for COVID-19, this is keeping my droplets in
On
from
you,
you.
right.
And only to me, from you. So we're keeping everybody protected. You know, really this will work, a surgical mask will work. We're really looking for like the N95s are like our healthcare providers. When they're directly working with a sick individual. That's
Gotcha.
when we would use our N95s.
Okay. All right. So I'm in events. You know, we do a lot of
Yep.
events. It's been a little tough here with going through this whole pandemic. We've rescheduled tons of stuff, but so I've heard about DJ, like different vendors and people getting sick and you know having to cancel. What's the best way for myself and my staff, other vendors that are in events, to protect themselves from these large gathering events, especially as a DJ? You know, people are coming up and they want to make those requests like they used to. We've changed gears a little bit, so of course, you know, there's events where people are wearing masks, you know, but we've also come up with a text system.
Yeah.
So people can actually, from their seat, they can text us.
Fabulous.
Yeah, text their request or their shout out at the event, and then we can receive it and go ahead and do that.
That's a fabulous idea because that's minimizing any social contact you have with someone. So think about the ways that you can best minimize contact with someone. So that is making sure everyone's wearing a mask. Everyone's wearing a mask. Keeping that mask on. Trying to maintain 6 feet social distancing. And then is there something that you guys could put up? So think about like I've even seen people do like shower curtains, like clear shower curtains around the DJ booth or around the booth, so you can still kind of see each other, but you have that protection around you.
Right.
So something that can protect you. But I love the text platform. That is fabulous.
I guess I've also noticed at events, people, you know, having sanitation stations.
Absolutely.
before
Yep. So hand sanitizer, washing your hands often.
at buffets and
Yep,
things
absolutely.
like that. A lot of places also, they will scoop it for you now, opposed to everyone getting their
and that's another
little
way.
mittens on.
Yeah, and that's
Spoons.
another way to prevent hygiene.
What else
So-
do we have?
Good hygiene.
Yeah, and then a lot of people are opting just to kind of cut their
Guest list in half.
list
And
way
that's,
down.
you know, that's something we'd obviously recommend because the fewer people you can have at an event, the better because it's less interaction.
Right. So any other suggestions, I guess, for the live events? We've seen folks reaching out, and I don't know, I think we're going to get there before we just open the floodgates again.
Right.
But it's going to probably be a gradual thing, I would suspect.
So I think the best way you can minimize contact with others is the best way to hold events. That's what we can really say.
I've seen people looking at like parking lot style events with large stage, large sound, and then people get like their own parking space. They can park off-site, bring their lawn chairs over, and then you know, text in their food order, their drink order to a row number and a spot number.
So any way you can get like that, any way you can get creative to figure out the best way to minimize contact with others is the best way to do it.
Yeah, because people are just itching. They want to have events, and they, you know, it's not the same when you just watch it on the screen. But
it's, you know, it's like I think about that. Like I miss going to concerts. I miss things like that. But for right now, this is our new normal, and this is going to be our new normal for a while. And we have to brace it, and we have to figure out ways to be creative and innovative to figure out how do we keep each other safe and healthy, but enjoy some of those things.
So we do have a few questions from viewers. Of course, we always reach out to our viewers and ask, you guys send us over. You can always DM us, of course, comment your feelings on some of the questions coming from viewers like you. So our first question, I think you've kind of already answered this one a bit, but have we already seen the curve here in Iowa?
Honestly, we have not. So what we've seen is what we look at is we're really still in stage 1, okay? Phase 1. And we haven't we've peaked a couple times, but we're still in it. When I mean like waves, we're still in our first wave. And I don't know when our second wave will be, because we think we're going down and then we peak right back up again.
Sure.
So we saw a peak in like April, May, then we peaked started to go down May, June, and then end of June and July it went up again, kind of went down a little bit, and then it keeps going back up again. So
that maybe gets into the next question here as well. I mean, there's a little bit maybe of that because of the testing,
right?
Testing waves, but yeah, people are still definitely. I know people now that have tested positive, and so yeah, it's definitely out here. The next one is someone asked, how can bars be open with people not respecting social distancing, but restaurants seem to be held to a different standard?
Yeah, I think that's a really difficult question to answer. I think a lot of it too is we as a community, we also really help to kind of police those businesses. So if you see something you don't like, you make sure to let them know, and social media is your best platform to express your feelings, because that's going to really get that information out there. But yeah, social bars, restaurants need to be held to the same standards. I very much agree with that.
Right, and I spoke with this person about this one, and they're like, well, the restaurants, they have the high backs now, and all these different things that they're trying to do, while, and all these seats missing, and they're held to that requirement, but we're all just jam-packed in the bar, and, you see and hear about people doing that, and, of course, it's a tough position for everyone because the bars are also losing revenue.
Absolutely.
And they could easily lose their butts.
I mean, think about it. If we're a business, we need to think about the best way to keep our community safe, because not only are we keeping our community safe, but it's also our business at line. So we need to make sure that we're following all of the guidance.
Right. Yep. Okay. Next question.
And you can obviously report those businesses to the government, to the governor's constituent line.
Wow.
Yep.
Okay. I know a lot have transitioned over to restaurant style. So I haven't been going out to know, so I couldn't really speak to anything. But okay, so we got that one. I think we covered that. This one's a tough one here. It says, how can we trust the safety of vaccines with the history of the CDC and World Health Organization? Then they put look up Tuskegee experiments with syphilis, and they said something about World Health testing in India.
Yep. So unfortunately, back in the day, we really used brown and black people as guinea pigs for a lot of that experimentation.
The CDC.
Yeah. So disgusting. What we've learned from that, we've learned a lot of lessons, and I very much understand why our community is worried about that. I get worried about that. I understand that, because there has been that disparity in the past with African Americans, our Hispanics, our Latinos, our Asians. So I think the biggest thing is we know now that we can trust it, because this isn't done anymore like it used to be done. We don't want history to ever repeat itself in that fashion. I think when we're looking at vaccines, we have to understand that vaccines that we use now today, they're under careful review by scientists, by healthcare professionals. They go under long studies. So right now, this is one of the best avenues that we have for us to keep our community safe. But I very much understand that, and that is always such a hard issue to talk about, because the Tuskegee study has definitely changed the way we view vaccine and we view medicine.
All right, next one we've got, for those people who believe that getting a flu shot or vaccine is literally injecting the virus into your system, how would you respond and justify vaccination?
Yeah.
And how would you persuade them to change their position?
That's a really great question, and that's something I talk about a lot. So when we think about a vaccine, okay, a vaccine is a dead or weakened form of that virus. So the flu shot's a dead form of the flu. So I'm going to get that flu shot injected into my body. Now what that does immediately is my body thinks I'm getting sick with the flu, but I'm not. So I'm kind of tricking my body. So when that vaccine comes in my body, it starts immediately building that protective wall. I always call it like your antibodies, your fighter cells, okay? And it builds that protective shield. So the next time that flu virus actually comes into me, I am going to be protected because I have that vaccine. Now I understand that there's a lot of concern about putting a virus into your body. But again, as we've talked about, we only give vaccines when they have been under really careful review by our scientists, by our healthcare providers. They go into an intense study for it to be actually given to you. So I think, honestly, vaccines are the best way to protect us against vaccine preventable diseases.
So that brings a question of my own,
Yeah.
I guess, at that point. With this COVID-19, some people are saying it's being rushed along too quickly, and how are we going to know, like, I'm not going to be the first person in line for that.
Right.
You know, so I've heard that quite a bit. So, man, it's just a hard judgment call on what is enough testing for something that didn't have decades of testing.
Right. And you have to understand, too, like, the scientists and the healthcare providers that are actually doing this, they have so much knowledge about vaccine preventable diseases, vaccines, viruses. So they have that knowledge and they're able to do that and put that into the vaccine. And you have to think about it too. The companies who are working on this have completely stopped everything else that they're doing to focus all of their time and resources on making this vaccine.
Someone else had mentioned Bill Gates and the World Health and the whole conspiracy. I don't know how conspiracy you're into, but he's a big advocate, and some people don't have trust in him for a variety of different reasons. But believing that he has spoken out about like population control and things like that. So like, if he's advocating for this, I'm not doing it.
Yeah.
So.
And I understand that, but we also have to realize that too. He's given a lot of money to help a lot of things health-wise in the community and in the world. I mean, you can think of all the things that he has done with women's health, with the HIV project. So he's done a lot in other things as well. But I understand conspiracies, and they change the way we look at things.
Sure. Just a couple more. You had mentioned there had been some communication about people thinking that the flu vaccine will give them COVID-19.
Right.
I hadn't heard that, but so that's interesting. I really wouldn't make sense of that either, but we do have a person that reached out. Many people take the flu shot. We kind of already covered this, but we'll take the flu shot and then feel like they get sick afterwards.
Absolutely.
And some people, you kind of said that your body, it does think it does have the flu.
Yeah.
It really does.
Yeah.
So, and but I think what the person was trying to say is that like it's introducing that to your body, and when you're getting sick from something, I guess just it's hard to do something to justify something like that.
Understandable. But I think the biggest thing too is by us getting vaccines, it's keeping us healthy. So think about this. Let's say you got the flu shot and you got the flu a little bit. Okay, we know a vaccine is not 100% effective, but let's say you didn't get the vaccine and you got the flu. Well, you could become hospitalized and you could have other severe health complications. So I think in a lot of senses, these vaccines, when we get them, they're helping protect us against long-term health consequences.
Do you feel like how many people they do feel that initial I'm sick and then they pass away from that?
That's very rare. So
like older people?
So when we see severe health consequences from vaccines, that's very, very rare. I mean, we see the numbers are so low on those So it's hard for us to really even quantify that, because I know that the risk, the benefits outweigh the risk immensely.
I was in a conversation as well. They were saying how they felt like, it kind of went with the Bill Gates thing.
Yeah.
In that conversation was that it's lowering your life expectancy longer term, and it damages, DNA and things like that.
Yeah, again, the benefits of a vaccine really outweigh the risks. That's the best thing that we can say, because our science has been studying this for years. Now, think about the very first vaccine. Like, I look at how long we've come from even the polio vaccine compared to, that was in the 50s, to now it's 2020. Our vaccines have improved immensely.
What else? I mean, so you guys are advocating for the flu shot.
Absolutely. Because think about the flu shot. It's going to keep, what I always think about the flu shot too is right now we have the flu and we have a mass pandemic. Okay? And by you getting the flu shot, you're keeping your community healthy. You're keeping you healthy, your community healthy, but you're also helping our hospitals and our healthcare systems. And if there are so many people who didn't get the flu shot and they were hospitalized, how could we take care of the most vulnerable population that need to be in the hospital? So we're helping keep the whole community healthy and moving to take care of our community.
Now the $1 million question: when can we take our mask off? And when, does anyone? No one knows that.
No one knows that. I mean, Dr. Fauci, he said 2021. Now we've heard 2021, but I think honestly this is a new way of life. So bedazzle them, get a mask for every outfit, because these things aren't going away.
So with what was the last one? Is it the swine? Not the swine flu. The
H1N1.
No, I mean like way long time ago.
Spanish flu.
Spanish flu. There you go.
1918 Spanish flu.
I read that they said that one was like 1.5 years or 2 years for that one until things kind of died down a bit.
We could easily see the same thing.
How long has it been? Since
been
March,
6 months.
Right? 6 months.
And how I do it is because my husband and I got our puppy in 6 months, so I always look at timelines.
What kind of puppy did you get?
We got a boxer pit mix.
Oh, high energy.
Yes, he's at doggy daycare right now, living his best life.
There you go. At least you keep him active, not at home all the time.
Nope, he loves it.
Awesome. Well, do you have anything else for us?
Nope, I just think I really want to encourage our listeners to, again, keep practicing the mitigation strategies, because the more we can do that, the more we can reduce the spread of COVID-19 in our community. So wearing your mask, social distancing, washing your hands, staying home when you're sick. And again, think about the decisions you're making. Like you said, you haven't been out very often. I haven't either, because again, I really think about the decisions. What you do impacts everyone you're around.
Sure. Yeah.
And questions, please reach out to Marty and I. I'm happy to help answer any additional questions.
Yeah, definitely. Leave any comments or any questions below, and we'll get those passed along as well. Thanks so much.
Thank you.